RFK Jr. just got confirmed as the Secretary of Health and Human Services.
Almost all the members of this panel, including yourself, are accepting millions of dollars from the pharmaceutical industry in their interests.
This is wildly important. What just happened?
Why do we have Fruit Loops in this country that have 18 or 19 ingredients, and you go to Canada and it's got 2 or 3?
The American medical system is broken. The American food system is broken. How great would it be for you to go to a grocery store and you see right on your food product, this may cause cancer? Sure. Let's give my kid a little bit of cancer. America will be healthy. America will be healthy because I think people are awake. Now, we want to get rid of the financial ties and all the potential corruption that could be happening. The fact that he's going to highlight this is going to change the game when it comes to the medications that you get to take every single day. Guys, great news. RFK was just confirmed as a Secretary of Health and Human Services.
Yeas are 52, the nays are 48. The confirmation is confirmed.
Robert F. Kennedy Jr. has been confirmed.
Confirming Robert F. Kennedy Jr.
Robert F. Kennedy Jr. as the nation's new Health and Human Services Secretary.
The confirmation paves the way for him to be sworn into the top health job, overseeing multiple high-profile agencies.
What does this mean? It means everything. It means that we don't have to be hopefully afraid of our food choices anymore. We can actually be able to have a healthy lifestyle again without having to look at nutritional labels, without having to look at where our food is sourced, without having to constantly think about the fact that our food is slowly killing us, causing us to have metabolic disease, causing us to constantly look at, holy shit, am I getting poisoned? Holy shit, do I need this drug? Does Big Pharma actually care about me? They don't. You're nothing but a dollar sign. So RFK has a huge list of things to tackle, and he has spoken about many things, but there are some specific key points that I'm personally excited about. The first one is addressing the chronic disease epidemic. And if you guys know anything about me, I am all about addressing chronic disease and addressing the underlying conditions. So what are causing the underlying conditions for chronic disease? He wants to launch a national task force to investigate the rates of autism. There's some weird things going on why the autism rates have climbed so greatly.
And we're talking autism rates because according to a new study, rates have tripled.
1 in 36 had autism in 2020.
Children have been identified with autism, and rates are higher among racial and ethnic groups.
Autoimmune disorders, allergies, other chronic diseases. He wants to reform dietary guidelines, and he wants to reflect on whole food, nutrient-dense diets over processed food. If you guys haven't noticed, the processed food in the United States, most of it is illegal in other countries.
We have 10,000 ingredients in our country, in our foods. The Europeans have only 400.
So tackling these problems here is getting at the root cause of what is causing disease, what's causing chronic disease. It's mainly focused around what we consume every single day. Why are we getting fat? Why are we getting sick? Why do we have chronic disease? Why are Americans dying earlier when the rest of the world is getting to more and more advanced ages? Introduce stricter guidelines on artificial additives, food dyes, preservatives.
Ingredients include a lot of poisons, including a harmful yellow dye called tatrazine, or yellow dye number 5.
And especially in children's products, because in the developmental ages, from growing up, if you're adding all of these things, they're saying that a lot of what we are introducing to children at an early age, not just food, but also medicines, also potentially vaccines, are what's causing ADHD, what's causing autism rates to increase, what's causing developmental issues, and what's causing them to have major hormone issues all along. One of the next major things that RFK wants to do is he wants to reform the FDA and the CDC.
RFK Jr. says it's time to clear out entire departments in the FDA.
This is one that I'm personally excited about because the ties with the FDA, the CDC, and Big Pharma, the people who are making our drugs, they're really, really apparent if you actually do the research and you actually look at kind of what's going on in the internals of these. One of the first things that he wants to do is he wants to remove pharmaceutical industry ties and conflicts of interest from regulatory bodies. What does that mean? The people who are starting and who are basically making regulation for this country when it comes to drugs, when it comes to pharmaceuticals, when it comes to other things that we have been introduced to, let's say during the pandemic, the ties that are coming directly from the pharmaceutical companies into the regulation bodies.
NIH reported recently that since 2012, there's been 8,000 major conflicts of interest with NIH research, with industry interest.
That's a really big conflict of interest. It means that Big Pharma was directly influencing basically our government on what regulations to actually put forth.
Corrupted FDA. They knew that oxycodone was addictive. They got FDA to tell doctors that it wasn't addictive. They pressured FDA to lie, and they got their way.
They're able to profit off of what regulations they are actually pushing. One of the easy ways to see this is lobbying. Who's one of the biggest lobbying firms in the government? You got it, Big Pharma. Big Food is number 2, by the way. Now, before we even get into medicine, before we talk about drugs, before we talk about anything like that, I want to talk about what is the most important thing for your health. And that's your nutrition. That's what you intake every single day. And one of the major points that RFK wants to hit is revamping public health and nutritional policies.
70% of our diet now is ultra-processed food because it's the cheapest food.
Now, because nutrition is number 1, and guys, I own a medical clinic, so I understand that this may look a certain way. I am not trying to sell medicine to anybody. I'm trying to sell a healthy lifestyle. And I'm trying to highlight what actually changes your health from the inside out. Now, in his revamping public health nutritional policies, one of the major points that he wants to hit is strengthening food labeling laws and requiring clear disclosures on GMOs, pesticides, harmful additives that are in food.
Our food safety system is failing to protect the health of our children.
How is it that some chemicals that are in our foods have long been banned elsewhere?
Most of FDA enforcement happens post-market. It's kind of like a game of whack-a-mole.
Which, by the way, he also wants to ban most of those things. But if you can't ban them, if they aren't banned yet, he wants them to at least be disclosed. If you guys ever seen a pack of cigarettes where it says, this causes cancer, this causes X, this can potentially go down this route from a health perspective. How great would it be for you to go to a grocery store and you see right on your food product, my kid wants these cupcakes, and you look at the front of that cupcake box and you see this may cause cancer. All you parents out there, how many of you are going to look at that and say, sure, why not? Let's give my kid a little bit of cancer. No, not a single one of you are going to do that. So this is majorly important. This last point of RFK's plan is one that I'm particularly excited about. Not because I'm just in the industry, because I own a clinic in this industry, but because I actually care about it, because I know that it works, because I know that it actually helps people get healthy, live longer, increase their health span, not just their lifespan. And this is expanding alternative and preventive medicine in this country, which has been really just pushed down because of mainstream medicine, because of Big Pharma, because of everything going on. And this is going to be majorly important for the future of your health as you age. One of the biggest things that he wants to start doing is increasing funding for research on alternative medicine, including homeopathy, herbal medicine, and traditional Chinese medicine. This stuff works for a reason. And if you guys didn't know, and especially the traditional Chinese medicine, I used to be this person that thought negatively of it. There's a reason that a lot of people in China are living into their hundreds. And there's a reason that a lot of people here are having major metabolic disease, dying of heart disease, and having all of these major medical problems starting at 50. They're doing something right. We should be researching it. Supporting insurance coverage for preventive health practices like acupuncture, functional medicine, and naturopathy. Now, again, you may think these are things that, well, this is not part of the traditional medicine platform. This is not part of, but I have a blood pressure issue. I should take a blood pressure medication. Should you? Or have you been taught to do that? Have you been taught to do that by Big Pharma, by mainstream medicine, by your primary care physicians and physicians that you see every single day? Well, yes, the answer is yes. And the reason why is because those doctors are taught to prescribe medicine.
Typically, doctors treat risk factors for a disease. So just giving a lifetime's worth of medications for, high blood pressure.
What we are looking for now in the new healthcare system of America is to prevent the problem. Let's find the root cause and let's get the problem solved. One of the last things on this list that, again, the most exciting thing for me, promoting access to peptide therapy, hormone replacement therapy, and regenerative medicine for aging populations. And I'm going to expand on this. It's not just for aging populations. It's for people that have had metabolic issues, hormone issues from all the toxicity in the environment, from all the toxicity in the food. Some of us have had too much damage done to our endocrine system, to our health, where we will need hormone replacement therapy, we will need peptide therapy, we will need regenerative medicine therapies earlier in life. maybe in our 30s, maybe even in our 20s. But having access to these medications, maybe having insurance cover them, maybe them being promoted through the healthcare system, that is going to be a major change for all of us, where we can actually increase that health span, not just the lifespan, increase the time you are alive and healthy and thriving. I want to see 80-year-olds and 90-year-olds at the gym working out. I want to see them jogging. I want to see them walking their dog. This is going to help with that whole thing. Imagine America with a focus on preventive medicine, with a focus on developing solutions for root cause health issues. And how about preventing how these diseases start in the first place with our food, and with our water supply?
I think fluoride is a poison.
So all of these things are going to make America healthy again, but not just in a drug fashion, not just in a, lifestyle fashion, in a fashion of where we can actually just live our lives and not have to worry about everything constantly poisoning us and making us die faster and be more sick and put us in the hospital at an earlier age. It's not just about fixing a broken system. It's about revamping how we think about healthcare and medicine. America will be healthy because I think people are awake. I think people have woken up to the fact that Big Pharma and big medicine and mainstream doctors and everything that we used to just trust has completely went out the window, especially post-pandemic. And now people are awake and they're looking for alternatives. They're looking for things outside of normal medicine. They're looking for preventive care. They're looking for better food. They're looking for better water. We're all very cognizant of the problems. And the fact that we just now have someone who's on the same page with us in RFK to say, hey, I see you, I understand what your problems are, and I'm gonna fix them from A to Z. This was just a highlight reel, guys. There are so many things that he's going to do, and I'm excited to talk about these in more videos. So if you guys like this kind of content, if you guys like me talking about food, about medicine, about Big Pharma, about regenerative medicine, about preventive medicine and hormone therapy and peptides, make sure you subscribe to the channel. Make sure you follow me. Go to my social media page. I have a bunch of short clips on all of this stuff. I'm excited to have this journey with you guys. I'm excited to get healthy with you.